Hi everyone, welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurological Wellness Institute here in downtown Chicago. And today's episode, we're answering the question, how do colored glasses help mitigate or help decrease light sensitivity? This happens especially after concussions or traumatic brain injuries. People get sensitive to light or pain in the eyes due to light called photophobia. And so versus photosensitivity, which is no pain, but just a sensitivity to that light. And light is, 80% of our stimuli or senses coming into the brain are from vision. We use vision a lot. And so when that light comes in, we're activating a lot of different pathways in the brain, and especially we're hitting the deepest part of the brain called the midbrain. And that is a lot of times where most concussions are going to involve. They're going to involve this midbrain because the midbrain is the top part of the brainstem, and the brain is going to move around on that, and it's going to shear these different axons or connections that are coming from the big part of the brain at the top down into the brainstem and the spinal cord. And so the midbrain is commonly damaged, and so therefore a lot of people get photosensitivity or photophobia following concussions. And so we can use these colored glasses to help mitigate that. And so I want to show a paper that studied all the different people that were concussed at a university and how different colored glasses can mitigate that. And so before we go to the study, I just want to show you what I'm talking about when it comes to these glasses. And so let's share this screen here. Okay, so these are the different types of glasses. And so they are within the colors of the rainbow, right? So red, orange, yellow, green to greenish blue, to blue, more blue, and violet, indigo. Okay, and so these different colors are basically blocking different wavelengths from coming in or enhancing certain wavelengths, enhancing different wavelengths of that visible spectrum. So I'm going to show that here in a second. But there is no rhyme or reason to which ones work the best for photosensitivity, photophobia, concussions. We will use them in different ways to enhance proper activation, so we can get just a little bit of activation into that midbrain to help with treatment. But the main thing is so that these colored glasses help decrease photosensitivity, so that people can go to work, they can drive, they can do different things that allow them to continue to live. Real quick, except driving should be sunglasses only. It shouldn't be colored glasses because these can disrupt a red, yellow light, blue, or red, yellow light, or a green light within that spectrum. So we don't want to necessarily wear them when we're driving, but we do want to maybe use them while we're doing other things, cooking, cleaning, reading, doing work, whatever it may be, to help mitigate these symptoms. So here is the visible light spectrum. And so visible light spectrum, we have very long wavelengths over here on the left. So these are moving slower, they have decreased energy, okay? As we move from radio waves to microwaves to infrared waves, now we're getting into this, this shorter wavelength, higher energy. And so the visible light spectrum is right in between infrared and UV, okay? And so we know UV is more from the sun. And so people that have light sensitivity to the sun, but maybe not like off a computer, that is, they're more sensitive to the UV light, not necessarily the blue light off the computer. And then X-rays, gamma rays, cosmic rays, okay, X-rays, gamma rays, maybe used for treatment, right? Different things, or to look at your bones, obviously. And so as we look at this visible light spectrum, these different colored glasses can change the wavelength coming in, or increase light coming in at these certain wavelengths. So red colored glasses is going to increase your increase that activity of that visible light of red versus orange, yellow, green, and blue. And each one is a little bit different depending on depending on the patient. We have to really just try them, see which ones work the best. And so that's a very quick description there. And then here is a paper from 2017 out of the Journal of Athletic Training. It's by Dr. Joseph Clark out of Cincinnati. And it's colored glasses to mitigate photophobia symptoms in post-traumatic brain. And so basically he says many photophobic patients experience relief from colored sunglasses, but they wanted to determine which ones were the best. And so they only looked at photophobia or photosensitivity patients. Screening was done with like a pen light, so they shined some pen light into their eye to make sure that their pupils constricted, all that worked, but then they asked for photosensitivity or sensitivity to light. And so basically for the results, 39 patients studied who had vision symptoms, 76 complained of photophobia. Okay, so some people had vision symptoms like double vision, blurred vision, but did not have photophobia. So using glasses of one or more colors, symptoms were relieved in 85% of the patients. So if 85% of the patients were able to have relief, that means 85 were able to do vision therapy better without symptoms, and therefore decrease or improve compliance of that vision therapy. The colors that provided the most relief were blue, green, red, and purple. So that's, it improves the patient's quality of life and may aid in the recovery process. That's the major point. So let's just go down to see which one to use. Okay, so frequency and percentage of relief from photophobia. So blue had the highest, okay? So blue was the best, which actually I see most probably in our clinic as well, blue being the best. And then red is normally in our clinic. But here they had blue, 45% found relief, versus green, 30% of people found relief with green, 27% found relief with red and purple, and then going down into more lighter colors. And so this is just something to look at and be aware of, because if you have photosensitivity, photophobia, sensitivity to light, eye pain with light, you don't need to suffer. And especially after concussions, this is something that can be used to mitigate symptoms in that recovery process, so that you can still do things that you need to do, whether that be work on a computer, work in general, read, exercise under normal overhead lighting. And so to me, this is a really vital thing that we should all be looking at, because traumatic brain injuries can decrease quality of life a lot. And so these colored glasses can really help our patients with these symptoms as we go forward. Just a side note, we also use these colored glasses a lot for different movement disorders or other like disorders within the basal ganglia, another deep part of the brain, because changing that light coming into the brain can also slightly increase different areas or decrease, and that can be promoting or helping these movement disorders and other neurological disorders. So I just wanted to throw that little tidbit out there as well. If you had any questions or comments, please leave them below. If you have any suggestions for future topics, I would love to hear them. Thank you very much, and have a great day. Stay healthy.